Welcome. Obtaining clinical sample for bacteriological examination. Obtaining clinical sample involves collecting a specimen from the suspected site of infection and sending it to a laboratory for analysis. This process is crucial for diagnosing infectious diseases caused by bacteria, also by virus or fungi or parasites. The steps for obtaining clinical sample: firstly, consulting with healthcare provider. The first step involves consulting a doctor or other healthcare provider who will discuss the symptoms and the medical history. Based on this, they will recommend or determine the need for microbiological examination and the type of sample required. Sample collection: a healthcare professional will collect the clinical sample using a sterile technique to minimize contamination. The specific collection method will depend on the type of sample being collected. Swab: this used to collect sections from various sites such as the throat, the nose, the ear canal, the wounds, the vagina. Blood culture: blood is drawn from a vein in the arm using a sterile needle and syringe and placed in special culture bottle. Urine sample collected in a sterile container during urination. Sputum: deep coughed up mucus from the lower respiratory tract. Tissue sample obtained through biopsy or surgical procedures. Sample transport: the collected sample is placed in a sterile container with a label containing relevant patient information and transported to the laboratory as soon as possible. In some cases, specific transport conditions, refrigeration, may be necessary to ensure the viability of the organisms. Laboratory analysis: in laboratory, the sample will undergo various tests depending on the suspected pathogen. Microscopy: sample examined under the microscope to identify the presence of microorganisms. Culture: the sample is inoculated onto a special media that allow the growth of microorganisms. The growth characteristic and the colony morphology of the organism can then be used for identification. This is the step of isolation identification. Serological test: these tests detect antibodies produced by the body immune system response to specific infection. Molecular test detect the genetic material of specific pathogens, and the result and diagnosis. The lab will analyze the result of the test and send the report to the healthcare provider. The healthcare provider will then discuss the result with the patient and determine the appropriate course of the treatment. Again, we repeat these steps. Sample collection: type of sample collected depend on the suspected location of the bacterial infection. Swab: types of the sample. Swab used for wounds, skin lesion, throat, ear, nose, and the urogenital tract. Sputum sample: deep cough to collect mucus from the lower respiratory tract for suspected pneumonia or bronchitis. Blood culture: if a bacterial bloodstream infection, sepsis, is suspected. Urine sample for urinary tract infections. Stool sample to obtain bacteria causing diarrhea or gastrointestinal issues. Tissue sample obtaining through biopsy or surgery for deeper infection or bone involvement. Lab technique: lab analysis, Gram-Stain rapid test that differentiate bacteria based on their cell wall structure into two broad groups, gram-positive, gram-negative. This helps guide further testing and antibiotic selection. Bacterial culture: sample placed on the culture media allow bacteria to grow. Once colonies appear, they are identified using various methods. Colony morphology: observing the size, the shape, the color, the texture of the bacterial colonies. We try to identify the bacteria. The bacteria is identified by its morphology, colony morphology. Biochemical test: these tests determine the metabolic capabilities of the bacteria, aiding in identification. Antibiotic susceptibility testing: This test identifies which antibiotic the bacteria are susceptible to, helping determine the most effective treatment, resulting in the results and diagnosis. Lab report will be detail the type bacteria identified, its susceptibility to antibiotic if tested, and any additional relevant information. The healthcare provider will use this report along with the symptoms and the medical history and other radiology or any aiding methods for diagnosing the disease, the bacterial infection is if involved, prescribe the most appropriate antibiotic treatment. For some bacterial infection, rapid diagnostic test may be used alongside the culture to expedite diagnosis and treatment decision. Scheme for clinical specimen. Please obtain the specimen correctly because it's affect the results. Explain completely to the patient. Use a sterile container. Label correctly. Send to lab appropriately. Avoid contamination of the container. Labeling critical to proper processing of the test requests. Pertinent clinical information is highly desirable. If not available, at least the following information should be provided: patient name, source of specimen or collection site, specimen and lesion status, test desired, timing of collection, sputum, urine, the type of collection, timing, the type of the sample, sputum, urine, stool, best collected early morning, sent to the lab at the same day. The blood as appropriate before treatment is initiated. Collect 2 or 3 sets early in the illness, early of the illness. Repeat if negative after 48 hours for growth. Blood suspected sepsis, endocarditis, osteomyelitis, meningitis, pneumonia, common pathogen, Pseudomonas aeruginosa, enteric bacteria, Staph aureus, streptobigens. Procedures: take about 5 to 10 ml from the adult, 1 to 5 ml from the infant. The blood aseptically from the vein. 2 culture bottle, anticoagulant and all-purpose media. Incubation, aerobic and anaerobic. Incubate in 35 centigrade for up to 5 days for culturing. Possible contamination rate reach 2 to 3%, and the contamination with strep epidermidis. The expected clinical cases or the expected diagnosis if we make culture: blood culture, sepsis, meningitis, osteomyelitis, septic arthritis, bacterial pneumonia. The culture recommendation: 2 sets of culture, 1 from each of the 2 prepared sites. The second drawn after a brief time interval. Then begin the therapy. Before beginning the therapy, we take the blood sample and try to culture the microorganism. After 48 hours, after 2 days, we try other. If it's negative, to say they, yes, this is negative. Assure sufficient sampling in cases of intermittent or low level bacteria. Minimize the confusion caused by positive culture resulting from transient bacteremia or skin contamination. Fever of unknown origin, occult abscesses, emphysema, typhoid fever. 2 sets of culture, 1 from each of 2 prepared sites. The second drawn after a brief time interval, 30 minutes. If culture are negative after 24 to 48 hours, obtain 2 more sets, preferably prior to an anticipated temperature rise. The yield after 4 sets of culture is minimal. All this procedure for ensure that the negative result is accurate, and we this is not contamination, it's isolated from the patient himself. Clinical disease suspected endocarditis, acute endocarditis. Obtain 3 blood culture set within 2 hours, then begin therapy. 95 to 99 of acute endocarditis patients untreated will yield a positive in one of the first 3 cultures. Subacute endocarditis, obtain 3 blood culture set on one day, repeat if negative after 24 hours, if still negative or if the patient had prior antibiotic therapy, repeat again. Adequate sample volume despite low level bacteremia or previous therapy should result in positive yield. Immunocompromised host AIDS, septicemia, fungemia, and mycobacteriemia. Obtain 2 sets of culture from each of 2 prepared sites. Low level of fungemia and mycobacteriemia frequently encountered. Suspected upper respiratory tract infection, pharyngitis. Procedures: nasopharyngeal culture, trial swab through the nose to touch the pharynx, gentle rotate and remove. This is a technique used to take the sample. Throat culture, use a tongue blade to avoid contamination with oral secretion. Swab both tonsil, fossa, posterior pharynx, and any inflamed or ulcerated areas. Throat swab, nasopharyngeal swab, and this nasal swab. Sputum, suspected of the lower respiratory tract infection, pneumonia or tuberculosis. Rinse mouth saline with water or saline, not mouthwash. Encourage deep cough with expectoration of the sputum. Sterile specimen collection. If patient unable to cough productively, induce sputum by respiratory therapist. Irritation, tracheal aspiration. Tracheal aspiration, tracheal gently irritated with lumen suction, catheter, specimen aspirated with a syringe. Bronchial swashing, use of bronchoscopic. Small amount of sputum is all that is required. 3 sputa consecutive days for mycobacteria. Spinal fluid, the suspected disease, meningitis, medical emergency, lumbar puncture, spinal tap, 1 ml for routine culture. The absolute minimum 0.5 ml for routine culture. Collect and transport in sterile and plastic container, as they need a specialized technique for obtaining this sample from special sites. Wound and abscess, suspected bites, burn, cuts. Disinfect the site, aspirate the pus, sterile sealing. Swab the culture tube not containing any transport media. The pus oxidate the amount about 3 to 5 ml. Urine, normal urine, its appearance pale to dark yellow, amber, clear. Normal urine volume about 750 to 2000 ml per 24 hours. If we collect the urine for 24 hours or 1 day, this is the normal amount. It's increased if we take some extra fluid, or it decreased when we reduce our fluid we drink. Also in fluid therapy, it's increased when some patients take fluid therapy or take some diuretics. Depends. Suspected polyneuritis or cystitis, the urinary tract infection. Causative agent: E. coli, Klebsiella, Enterobacter, Proteus, Pseudomonas, Staph saprophyticus, Enterococcus faecalis. The procedure: clean and catch or midstream sample. they collect the midstream of the urine, not the first drops or the last stream, the midstream, about 10 to 50 ml. This is the ideal sample for urine culture. Fecal suspected enterocolitis, foodborne, waterborne infection. Procedure must include liquid of stool, collect blood mucus if present. A small amount will form stool, 5 or 6 tablespoons water stool. Plastic cup with tight fitting lid containing BO4 buffer must reach lab in 30 minutes. For the test for amoebic trophozoite genital, suspected STD, sexually transmitted diseases. Procedure: collection of this discharge. If no discharge, swab anterior urethra. First, early morning urine. Female, swab of the cervix and urethra. Bone marrow, suspected fungal infection. Procedure: approximately 0.3 ml. Bone marrow is a heparinized tube. Thank you.